I'm a urologist here at Urology Clinics of North Texas. My specialty is male infertility and sexual dysfunction. So we see men who are having difficulty conceiving, find out why, and then that will help us direct a treatment to ultimately help them become fathers. If men are having other issues related to sexual function, we do similar things to help them achieve their goals. If a man has had a vasectomy and later decides he wants to have children, he's not alone. A small percentage of all men who get a vasectomy will ultimately change their mind and want further children. A good candidate for a vasectomy reversal is any man who is healthy enough for general anesthesia, who has had a vasectomy and is looking to have more children. Their chances of success are variable. The shorter it's been since their vasectomy, the higher their chances of success. But successful reversals have been performed regularly in men whose vasectomy was over 15 or 20 years old. And so that's a more detailed discussion that you can have with your urologist as to what your individual success rates would be expected to be. A vasectomy reversal is a process where we undo the blockage and reconnect the vas deferens so that sperm flow is reestablished and a man regains his fertility. A vasectomy reversal is usually done under general anesthesia because it takes an hour and a half or 2 hours. We're dealing with small structures, and so we're going to use an operating microscope to see those structures really well. And then those structures are reconnected using suture that are hard to see with the naked eye. And we do that because we want to get as precise of an alignment as possible. That's what dictates our success, is how well we can realign those channels so that they will heal well without scarring. One thing we encounter commonly these days is men that are on testosterone replacement therapy. They will want to talk with their doctor about getting off of that because often that impairs their sperm production. There are no restrictions on sexual activity leading up to the procedure. Otherwise, the man just wants to make sure that he's healthy enough for general anesthesia. We'll have you not eat after midnight the night before, and if you're taking any blood thinners like aspirin or Plavix or Eliquis, we'd also have had you stop those about a week before. At that point, you're pretty much ready to go, and we'll do the rest. Well, fortunately, a vasectomy reversal is a very low-risk procedure. General anesthesia is extremely safe. The big thing that we concern ourselves with is, are we going to have good results? Are we going to get sperm back in the semen? And of course, that's not a guarantee, but we have a high success rate, average of 80% or so. There can be some internal bleeding in the scrotum after the surgery where you get what we would call a hematoma, or a collection of blood in the scrotum. It's not harmful to your health, but it's certainly uncomfortable in an undesired situation. Rarely does that require any additional treatment other than warm soaks and rest. Infection would be exceedingly uncommon because the scrotum is a vascular area, heals very well. And besides those things, there's really no particular risk of undergoing vasectomy reversal. We recommend that for the first few days after the procedure, you rest and ice the scrotal area intermittently throughout the day. We ask that patients not engage in sexual activity or physical exercise for 2 weeks. Most people can return to work after a few days unless they have an unusually strenuous and physically active job. Patients are sent home with a few days of antibiotics and pain medication to be taken as needed. After 2 to 3 weeks, we do encourage patients to resume sexual activity. There should be no change in erectile function, ability to climax. Those things should be unaffected. Is vasectomy reversal covered by your insurance? That question is hard to answer definitively, but often it is not a covered benefit under most people's insurance plans, so it is a cash pay or out-of-pocket expense. Knowing that ahead of time, we have developed set prices with the surgery center and our anesthesia providers so that the patient knows what they will pay in advance, and we've kept that as low as possible. Vasectomy reversal is a specialized procedure that may not be performed very often by most urologists. These advanced microsurgical techniques have really helped men who want a family or want to add to their family have success, and urologists here at Urology Clinics of North Texas take pride in being able to participate in that process.